Good afternoon. I'll call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee, and today I'm joined by council members Jacob Fry, Lisa Bender, and Alondra Cano. We are a quorum of the committee, and we can conduct the committee's business. We have 9 items on our agenda today. The first 6 items are consent items. I'll read through those, and if somebody wants to pull one off to ask a question or make a comment, we can do that. I'm also going to move item number 9 as a consent agenda just to postpone it in committee. Item number 1 is passage of a resolution supporting Earth Hour 2017. Item 2 is authorizing contracts with 3 organizations to provide services for victims of domestic violence. Item number 3 is authorizing contracts with 2 entities to provide designated services for victims of sex trafficking and commercial sexual exploitation. Item 4 is authorizing a 5-year agreement with the University of Minnesota Medical School's Academic General Pediatrics Fellowship Program to provide educational experiences for medical residents in our school-based clinic program. Item number 5 is authorizing a grant submittal to the Merck Foundation for funding up to $1.5 million over 5 years to reduce the impact of diabetes. And item 6 is setting a public hearing for April 17th for the short-term food ordinance that was introduced at the council on the last meeting. And item 9, which I'll also have on consent, is just to postpone the recommendations on the use of recycled tire mulch that was referred back to the committee by the council at its last meeting. Does anyone have any questions or comments on those items? Councilmember Cano?
I do have, thank you, Mr. Chair. I do have a question on the item number 3, the contracts for the addressing the commercial sexual exploitation. So I believe that we had agreed to a $75,000 amount to give out to through an RFP process. So I'm just wondering, I see 2 items, one for $25,000 and a second one for $25,000, but I don't see a third for another $25,000. So I'm just wondering if the staff could help.
Let's see if Nigel Perot maybe can, or Coral Gardner, or somebody can help clarify. Is that something you might have an answer to?
Yes, Council Chair. From my understanding, that $50,000 was the allotted amount, not the $75,000. So unless there's something different, I'd be willing to look at that again then.
Well, we'll have to go back and look at the council action, I think, to make sure. Oh,
Gretchen might have some other
okay.
information.
Good afternoon, Mr. Chair, Councilmember Cano. I'm guessing. I believe that there was a component that was to be taken out of carry forward dollars or unspent dollars from 16 into 17 that might have comprised the other portion of this, but we will have to check on that. And that would have delayed the availability of those dollars.
Okay, so they may be part of what we do in April with.
If that is the correct answer, Mr.
Okay.
Chair.
Okay, I will follow up. Thank you.
Any other questions about any of the consent items? Councilmember Bender.
Thank you, Mr. Chair. It's actually on page 1307 of the budget. It looks like 50,000 there. The health department to be allocated $50,000, but maybe there was some back and forth, and we ended up having to reduce the amount that had been proposed or something. But I'm trying to look it up. I don't have it now that we approved. I can email it.
Okay, well, thank you for that attempt at getting clarity. We'll have to do some more research, I guess. But in the meantime, I'm going to move forward as is anyway. And with all the other consent items, all those in favor, please say aye.
Aye.
Any opposed? Those motions carry then. Now, I did have a request from a committee member to move number 8 ahead of number 7. Councilmember Fry, would that still work better for you? I wonder if we could do that. So I wonder if without any advance warning, that'll be too confusing. Is Mr. Huff's not here? Oh, would that be all right? Could you come up and give us the presentation then on number 8, which is we're going to receive and file a presentation and a report on environmental health assessment in establishments with adult entertainment licensure. All right, and I think a lot of people might have come here for the other item, but hopefully this won't take us too long. Apologize for any inconvenience.
Mr. Chair, council members, my name is Dan Huff. I am the Director of Environmental Health with the Minneapolis Health Department. Today we're giving a presentation on an environmental health assessment that we performed in our adult entertainment license establishments. Joining me today is Dane Huber, who will be speaking about our methodology, and also McGean Keynes, who wrote the epidemiological brief that is attached in your agenda packet. Going to start. The health department has received over the last couple of years complaints from both the public and other city licenses or city staff about conditions of concern within our adult entertainment facilities. And from the health department perspective, we were concerned about the potential for a public health hazard. We are concerned because of infectious disease risk. OSHA considers any bodily fluid to be other potentially infectious material, that is, material that might contain bloodborne pathogens. These diseases include anything from HIV to hepatitis to gonorrhea, syphilis, any disease that could be transferred via bodily fluid. I'm going to turn it over to Dane Huber, a health inspector, who will talk about our sampling regime, and then I'll talk about our results.
Chair Gordon, council members, my name is Dane Huber. I'm a health inspector with the City Health Department, and I'm here to give a brief overview of the methods that were used in the field and in the lab. First, I'd like to thank the staff members that assisted with this. We had 5 teams of 2 inspectors out in the field and 3 staff members in the lab analyzing samples. It took a handful of people to get this accomplished. We inspected all 17 establishments with an adult entertainment license in Minneapolis. The inspections involved a visual test of each establishment. We used 3 different light sources to search the establishments for stains. We had just a standard white flashlight, a black light that would help us find fluorescing stains, and then a third light is a blue light, a 455 nanometer blue light, when combined with orange filter goggles, is more specific to semen stains. It makes them fluoresce. We used these 3 tools to scan the areas and look for stains that could be of interest to our study. But this is not a confirmatory test. It just put us in the area of stains. Here is an example of an area that was sampled and a stain that was found under black light on the couch. And this is an example of an area sampled, a surface that was sampled under standard white light, and then the blue light with orange filter goggles that makes the stain pop out. Because we can't confirm the source of the stain with the lights, we had to take samples and bring them back for analysis. Our field samplers, when they found a stain, they used sterile swabs to absorb material from the stain, package that, and then record information regarding the stain, such as where the stain was located, a description of the surface, who took the sample, time, place, etc. There was also a photograph taken of every stain that was sampled. The samples were then brought back to our health department lab where we used the RSID rapid stain identification kit. That's a very simple confirmatory test that checks for the antigen found only in human semen. It's used in other settings as a screening tool to ensure that semen is on a stain prior to more expensive analysis. We were only using it as a presence-absence test, much like a pregnancy test. We'd add the sample swab to solution, add the solution to a cassette, wait 10 minutes, and a visual result would appear. One line on the cassette indicates a negative result. The antigen in semen was not found on the sample swab that was tested. 2 lines indicates a positive result, that we could confirm that semen was in the sample. We also ran quality control samples to verify that the lab test was working properly, and we're confident in our positive results. Only this antigen would be able to turn a sample positive. And we're looking into making improvements in our sampling technique to ensure that the stain is properly being sampled onto the swab. Based on what we found, we had three ratings to give the establishments. Satisfactory, there was no visual result. We couldn't find any stains of interest. And of course, since nothing was taken, there was no lab confirmation. Suspected, we took samples. We suspected that a stain could be of interest to us, but we couldn't confirm in the lab. And then a confirmed result, positive visual inspection, and a positive lab result. With that, I'll hand it back to Dan.
Thank you, Dane. And so what we found is that of the 17 establishments, we found that 3 were satisfactory, 3 were suspected, and 11 actually were confirmed. Our satisfactory rating at these 3 establishments, there was no area of concern. Everything looked to be maintained in a cleanly order. We had 3 establishments where we had the visual inspection with our lights indicated areas of concern. And then we had these 11 that actually we had confirmatory tests for the potentially infectious material was present. What we found is that there was a correlation between the way that an establishment was designed or laid out. If you look here, you'll notice that every one of these areas has what are called VIP areas or private or semi-private spaces, either with couches or beds. The clubs that have these private spaces or semi-private spaces are the ones where we found the most examples of both the visual and the confirmatory tests of potentially infectious material. Our current regulatory tools, and why we're really bringing this to you today, we have some clunky tools. We have our own city ordinance, which is our high-risk sexual conduct ordinance. We have used that more recently. However, it is a very outdated ordinance. It has what may be considered judgmental language about some of members of our community. It's not an ordinance that we can really use effectively until we come back to you with some revisions on that. It's also just invalid on it's got incorrect, outdated science and lacks effective enforcement. What we used for enforcement under this case was we did issue orders under our public health nuisance statute. However, that also does not conform to the city's regulatory administrative enforcement process. So our next step, we have sent orders. We will be doing a reinspection to see if the cleaning of those establishments has occurred. One issue that the question that was raised for us, what's going on? Why are we seeing these types of conditions in these establishments? All we can do from an environmental health perspective is to go and find the presence or absence of material. What we have done then is we are partnering with Dr. Lauren Martin from the University of Minnesota. Dr. Martin is well known for her work looking at and working with communities that are traditionally difficult to research or to find information because they're more fringe communities. And she has worked with entertainers in the industry and will be presenting at our next meeting what her findings and the findings of her team are, which I believe will be very elucidating for us as we dive into the topic of policy options in addressing both our public health concerns and then what are the other issues that might be faced by the workers or patrons in these establishments. Thank you.
Thank you very much. I don't see any questions from committee members. I think the idea now is we will wait till we have the information that we get in 2 weeks from the University of Minnesota. Give people a chance maybe to take this in and we'll develop a game plan from there. So I'm just going to move to receive and file this today. Any discussion on that motion? All those in favor say aye.
Aye.
Any opposed, say no. That motion carries. And so now we can move to our item 7, and this is a presentation on the public impact of menthol tobacco. Also coming to us from the Health Department. And welcome, Commissioner
Thank you once
Reeskamp.
again. Good afternoon, Mr. Chair, members of the committee. I'm just going to do a little introductory, cover the first slide or so, and then turn it over to Deanna Pennington, who's a public health specialist with our department, has been working deeply with the community on this topic. And then we have several folks representing organizations in the community that have also been working on the issue of menthol in tobacco. But I want to start with just sort of a reminder about 2015. The City Council passed an ordinance that amended the way that the pricing that we have for for tobacco products, and also established an expectation that flavored tobacco products only be sold in tobacco-only stores. We did exempt menthol flavoring from those ordinances at the time. And yet we heard from the community as they provided public testimony that that was an oversight that we needed to come back to. And so that's what we're doing today. As a result of the ordinance, flavored tobacco products are available in 25 stores today, tobacco-only stores, as opposed to 300 stores, which included gas stations and convenience stores and many community sources of tobacco before the ordinance. Citywide checks and checks by other groups show that most stores are complying with the ordinance. As I mentioned, we heard concern from community members about omitting menthol, and so we're back to discuss that today. Since the sales ordinance was passed and implemented, the Health Department has gathered more information on the public health impact of menthol tobacco, and you'll hear about that today. And as I've mentioned, the community groups, they've been leading efforts to engage both youth and adults from across the city to bring that information to you about menthol tobacco use as well. And so we're here today to share the broader context of menthol tobacco. Deanna will do that, and then to hear from the 3 community groups about their work. So I'll turn it over to Deanna, and then we'll stand for questions at the end.
Welcome.
Good afternoon, Mr. Chair, committee members. Menthol is a common flavoring additive used in tobacco. Menthol on its own produces a minty taste, a cooling sensation, and has anesthetic or numbing qualities. What's unique about menthol is that when used in tobacco, it masks the harshness, making it easier to get addicted. It also increases nicotine absorption, leading to stronger addiction, which makes it harder to quit mentholated tobacco. This is particularly troubling when we look at youth tobacco use data. According to the 2014 Minnesota Youth Tobacco Survey, nearly half of Minnesota high school students who smoke use menthol. This is much higher than the adult menthol use rate, and preference for menthol cigarettes has more than doubled since 2000. In addition to menthol being more popular among youth, menthol is also higher in certain communities.
In Minnesota, the low smoking rate of 14% hides the disparities that exist between whites and communities of color in the American Indian community. For example, the African American community has a tobacco use rate of 22%, and an overwhelming majority, approximately 80% of these smokers, smoke menthol. The American Indian community smoking rate is the highest for any community. According to the Tribal Tobacco Use Project, 59% of American Indians in Minnesota use commercial tobacco, and almost a third is menthol. And lastly, national data shows that menthol is higher among those that identify as LGBT smokers and women smokers. This data shows the significant impact of menthol tobacco on youth and communities of color. And at the federal level, the Food and Drug Administration has issued several reports. A 2011 report concluded that removing cigarettes from the marketplace would benefit public health. And 2 years later, they concluded that menthol poses a public health risk that exceeds the risk posed by non-menthol cigarettes. Because again, menthol is associated with youth smoking initiation and greater addiction. However, at this time, the FDA is not expected to act on menthol tobacco. And so, local communities have started restricting menthol tobacco sales. Chicago was the first community to restrict menthol sales in late 2013. The law was challenged in federal court, and Chicago's restriction was upheld. Since then, other communities such as Berkeley, El Cerrito, Hayward, and Santa Clara County have restricted the sale of menthol tobacco. I'd like to invite our community speakers up. We have 3 organizations: Indigenous Peoples Task Force, the African American Leadership Forum, and North Point's Breathe Free North program, who will share their work engaging community members.
Could I just ask one quick question?
Yeah.
About those cities that you listed, did they restrict the sale by spacing to elementary schools or some other way?
Chicago and Berkeley restricted sales within 500 feet of elementary schools.
Okay.
El Cerrito, Hayward, and Santa Clara County, those were just general menthol sales restrictions.
Did they restrict the sale of menthol to adult-only tobacco shops, or they just banned? They did not.
Some of them did include just adult tobacco onlys, and then some just had broad restrictions in their whole jurisdiction.
Okay, interesting. Thank you. Now go ahead and introduce the.
Great. So Indigenous Peoples Task Force.
Good afternoon. My name is Brenna Deppis, and I lead the Native Youth Menthol Coalition at Indigenous Peoples Task Force. It is important to know that commercial tobacco abuse within the Native community impacts both spiritual practices and physical health. Traditional tobacco is a part of Native spiritual practices used for prayer, during funerals, as gifts, and during ceremonies. I am here with 2 youth who started working with me in March 2016 to learn about menthol cigarette use within the community. We conducted a survey in our neighborhood and found that smoking is perceived as normal and menthol use is high. However, 50% of both smokers and non-smokers support making a change to limit access of menthol cigarettes to Native youth. I'm with 2 youth today who are going to share their experience.
Good afternoon.
Hi, my name is Audie Ellis. I live in the Phillips neighborhood. I'm concerned about menthol tobacco because it's popular with my friends and easy to access. When I was an underage smoker, I would sit in front of stores with my friends and ask people to buy me cigarettes. Youth wouldn't be able to do that around a tobacco-only shop like a convenience store. So I think menthol tobacco should be restricted to tobacco-only stores. This prevents future generations from becoming addicted to menthol tobacco.
Thank you.
Thank you.
Hi, my name is Ashley Hicks. I live in Little Earth, which is located in the Phillips community. I'm concerned about menthol cigarettes because a lot of our young people start out smoking menthol cigarettes. I am one of them. As you have heard today, menthol is much more addictive than any other cigarettes. I am currently struggling to quit smoking menthol. My problem is going through withdrawal and craving cigarettes. The longest I've gone about is 3 weeks. I am still working on quitting. What I am asking of you is to support limiting where menthol products are sold. This will prevent other young people from experiencing the struggle of quitting. Thank you for your time.
Thank you very much for coming in. Welcome.
Good afternoon, council members. My name is Gene Nichols. I live in Shoreview, Minnesota. I'm with the African American Leadership Forum Health and Wellness Group co-chair. The tobacco industry has targeted the African American community with menthol products for generations. Our organization, in partnership with local metro health departments, is leading an assessment and engagement project on how menthol tobacco is affecting our community. We've collected surveys from over 400 African Americans in the metro area, mostly in Minneapolis and St. Paul, and met with 10 key community leaders to gain insight into the perceptions of menthol tobacco within the African American community. We found that the Twin Cities African Americans believe menthol is a serious threat to their health, that the tobacco industry has heavily targeted them with menthol tobacco marketing, and that they support new laws to reduce the harm in their community. Other relevant information, and I did leave some information for you to review later on. Other relevant information is 84% of the smokers that we did survey indicated that they use menthol-flavored products. And smokers were attracted to menthol products because they taste and feel different than other cigarettes. In closing, I would like to highlight two concerns expressed by our key community leaders. One, menthol products are attractive based on taste, familiarity, accessibility, and price. And two, the cool, with a C, factor or peer influence among teens and young adults is very concerning to our key community leaders. Thank you for considering my comments.
Thank you very much for being here today.
Hello.
Welcome.
Good
Hi.
afternoon. My name is Tatiana Morrow, and I live in North Minneapolis. I am a member of the Breathe Free North group at North Point Health and Wellness. Our group works to reduce the harm tobacco causes African Americans who live in Minneapolis. Lately, we've been working to educate our community about the harms of menthol cigarettes. The tobacco industry targets my community with menthol advertising. Stores in my neighborhood are covered in ads for menthol cigarettes, and these products are available on nearly every corner. Because of this type of marketing, African Americans use menthol cigarettes more than any other group, and we suffer from higher rates of sickness caused by smoking. I think it is wrong that tobacco companies target me and members of my community with deadly products. I hope that the City Council will take action to protect my community from menthol cigarettes. I would like to show a video of some of our previous work in the community.
Ever since it's been around, just a spoonful of menthol helps the poison go down.
Smoke-related illness is killing us, disproportionately Black men and youth.
Far surpassing any other drug, disease, or car crashes. And it's no accident.
The ashtray leads to our ashes.
Sin embargo, esa no es la historia que ustedes nos cuentan. Ustedes, con sus anuncios, disfrazan el sabor de la muerte. Ustedes no nos dicen las tasas de la mortalidad, tampoco nos dicen lo que vamos a pagar, la deuda por cada aliento.
You're betting on us to ignore the Surgeon General's warning.
You improve profit margins when you profit off those in the margins, making us think you're our friends by giving us a bargain.
Like a van, parked out on the corner giving away free sample cartons.
It's all addictive, and menthol makes quitting even harder.
It's disgusting to see how you focus your campaign on the young, Black, and dumb.
That's the way you described us, saying, the younger the better. Black lungs don't matter, as long as our pockets get fatter. We don't smoke it, so it don't matter.
We're not buying these lies you're telling us. It's all just smoke, you're blowing us.
RJ Reynolds said he'd never smoke it, but he's selling it to us. Sponsoring our favorite concerts, movies, and magazines. But we're here to tell you that we're on to your scheme. We see the ugly truths behind the smoke screen, the beautiful lies that we won't believe.
Stop selling us these beautiful lies and ugly truths.
Cause we ain't buying them.
Cause we ain't buying them.
Cause we ain't buying them.
Cause I ain't buying them.
Thank you.
Nice.
Thank you. So there's some familiar faces in the audience that participated in that video. It's pretty awesome, right? Oh,
Yes.
sorry. I'm Latricia Vito.
and I'm the Health and Advocacy Manager at North Point Health and Wellness Center. I came to you before in 2015 to ask you to restrict fruit-flavored and candy-flavored tobacco products. This council voted unanimously in support of this restriction. At that time, Councilmember Fry, you asked me about menthol. You said, why are we leaving this out? Like, what are we going to do about menthol? And we told you we'd be back. We're here. And so I agree with you. I agree that we need to remove the exemption for menthol, and now is the time to do that. We don't want to wait too long to do that. Thanks to tobacco company target marketing, menthol cigarettes are firmly embedded in the Black community. But it doesn't have to be this way. Over the past year, North Point has been working with a coalition of more than 30 people and 30 organizations to educate the community about the harms of menthol through a new campaign called The Beautiful Lie, Ugly Truth. That's one of the education videos that you just saw. This message is simple. The tobacco companies sell us beautiful lies about tobacco. Open almost any magazine and you will see images of beautiful and happy people in Newport ads. They've been doing this for decades. In the 1970s, they sold menthol cigarettes to my community by using Black Power messages. This systemic and nonstop targeting of the Black community continues to this day. As recently, a couple of months ago, RJ Reynolds, the company that makes the #1 menthol cigarette Newport, sent Reverend Al Sharpton to Minneapolis. I don't know if you heard, but I took him down. It was pretty good. But they sent him to a Black church while we were having a tobacco conference in St. Paul. So all of the advocates were all tied up in education, and there was a lunch meeting which Al Sharpton came to host at a church, and they were talking about menthol. It pains me to say that the tobacco companies have infiltrated my community with many leaders. I mean, Al Sharpton, for one, he's a leader in this community. A lot of people at that church couldn't believe that he was there for that reason. If it's Al Sharpton, it couldn't be anything bad. The beautiful tobacco company lies cover up the ugly truth. My community suffers disproportionately from the harms of tobacco, and menthol is the primary cause of this suffering. Tobacco is still the #1 cause of death for African Americans. Now is the time to put a stop to this and protect future generations from an industry that has no shame. I stand here today representing a coalition of more than 30 people and ask you to please help us put an end to this blatant tobacco industry targeting. Thank you.
Thank you very much. Is there anybody else, or is that to conclude the presentation? Well, thank you very much. And it was an excellent presentation, and I appreciated hearing that. Are there any questions or comments from committee members? Councilmember Fry.
Thank you, Mr. Chair. Just briefly. So I didn't even realize this. So Al Sharpton was actually here to promote menthols? That was happening during the service? Sorry to make you get back up.
So what it was they sent out a flyer to a church saying that they were going to discuss the criminalization of Black men. It was around menthol tobacco. So it was like, I mean, I can send you an audio tape of it, but it was outrageous. They related the crime in Chicago to the sale of loose cigarettes. It was Al Sharpton, former Senator Kendrick Meeks, and then 2 law enforcement professionals. And they all spoke about different experiences around tobacco. One of them even cried.
And it was they were favorable experiences?
No, they were trying to say don't ban. They had this, they're saying banning menthol, so they were here speaking about not banning it. We should not ban it because Black men are going to be criminalized.
Oh,
there's
okay, I understand what you're saying.
There's going to be an underground market. The police will start targeting Black men for Newport cigarettes.
I understand.
Yes.
Thank
Okay.
you.
No problem.
I remember hearing about that when he was in town also, and it seemed like, though, there wasn't a lot of press about it. Somehow, whatever you did, probably yourself, or maybe in a coalition, softened what he was willing to say and be public about. So I appreciate that. I think this is definitely an issue that we've talked about a lot, we've thought about it a lot, and I know when we passed our flavored tobacco, we noticed there was an exemption for mint and menthol. And I think there's some interest on the council in taking it forward. I'm certainly going to be thinking about it. But I think for today, all I want to do with this is receive and file the report, and then we can strategize about it in the future. I do want to say that the more outreach and the more conversations in your community, the more support that you can build from the residents in the city of Minneapolis will only do your cause good. And you're already doing fantastic. But having youth come in and speak about this, and people who from different communities and being organized about it will help us get the courage that we may need to take the step forward and take on the obvious opposition that you know will come forward. So on that note, I'll move to receive and file this awesome presentation. Seeing no discussion, all those in favor say aye.
Aye.
Any opposed? That motion carries. And then I don't see any other business before us, so this meeting is adjourned. Thank you, everybody.